Today, we're gonna talk about speech and language impairment. What is it about, and what are the symptoms or signs of a child having speech and language disorder? And also, what are the categories and domains of speech and language impairment, as well as the causes of speech and language impairment? And what are the different classrooms activities that the teacher does in teaching students with speech and language impairment? Speech and language impairment, defined as a communication disorder such as stuttering, impaired articulation and language, or voice impairment that adversely affects a child's educational performance. According to the recent studies, speech and language impairment make up about 19 to 20% receiving special education services. These students have trouble communicating, doing class presentation, and participating. Students with speech-language impairment are identified at a very younger age. Speech and language are different. The difference between speech and language is one of the most fundamental topics in the field of special education. Speech is the production of sound, and language is the comprehension of a spoken, written, or other symbol-based system. Speech impairment include trouble saying sounds, stutter when you speak, and voice problems. Speech are broken up into three categories: articulation, voice, and fluency. Articulation is the way we produce sound by moving the mouth, lips, and tongue. The way we say b by building up air in our mouth and putting our lips together, or the way we say k by raising the back of our tongue and releasing the air. Articulation disorders, these are the motoric difficulties that results in omissions, substitutions, distortions, and additions. Omissions, for example, is erd instead of a bird, do instead of door. For substitution, wove instead of love, tabor instead of table. For distortion, the student may distort a sound so that it looks like another sound. Example, bro instead of school, jiff instead of sleep. Then addition, example of this is race instead of race, apple instead of apple. Second category is the voice. Voice is associated with our vocal cords. When air is inhaled and exhaled from the lungs, we have the opportunity to make phonations with our vocal cords. Voice disorders, these are problems with the quality or use of one's voice resulting from disorders in the larynx. If somebody abuses their voice by talking too loud or shouting, they could develop voice disorder. These are characterized by abnormal production or absences of vocal quality, pitch, loudness, resonance, or duration. Third is fluency, the smoothness or the rhythm to our speech. Fluency is the most associated with stuttering. People who stutter may repeat a sound or use too many fillers such as or ah. Fluency disorders, these are difficulties with rhythm and timing of speech. Stuttering, these are fast repetitions of sounds, especially at the beginning of words. Prolongations, hesitations, interjections, and complete verbal blocks. Cluttering, these are excessively fast and jerky speech. We are done with the speech. Let's proceed to language. Language is the comprehension of a spoken, written, or other symbol-based system. Language broken into two parts, the receptive language and expressive language. People with receptive language disorder have problems understanding and processing what others say to them despite having no hearing problems. Expressive language disorder causes problems with using words to express thoughts, although the person has no physical problems in pronouncing the words themselves. Lesson preparation and material for receptive language. First is highlight key concepts and vocabulary. Make the purpose of the lesson explicitly clear. Create obvious links to previously learned material using graphic outlines. Second, go from concrete to abstract materials and incorporate visual supports. Third, incorporate visual or symbol support when preparing handouts. Fourth, encourage the use of graphic organizers. Previous particularly or provide particularly completed charts, tables if necessary. Teaching strategies. We have here 8 teaching strategies for receptive language. First is teach skills one at a time. Second is consistently check understanding. Third is break instructions down into smaller parts and allow time in between and give in the correct order. Fourth is encourage students to ask questions. Fifth is emphasize sequence. Sixth is use role play to demonstrate the delineation between speaker and listener. 7. Speak slowly and clearly but not so slowly as to obscure the message. 8 is use hand gestures, pictures, and facial expressions to support the message. Next is expressive language. Implications for instruction. First, use visuals, symbols, or photos to help students organize and communicate their thoughts. Second, be patient when the student is speaking. Third, help students connect new words and information to pre-existing knowledge. Fourth is use visual to support expressive language skills. Developmental language disorder, or the DLG, is diagnosed when a child's language skills are persistently below the level expected for child's age. Typical children can say that boy cuts shape out of paper with sharp scissors. On the other hand, DLD might say him doing cuts. So dako jud kay siya kalahian. Language is composed of 5 domains. First is the phonology, semantics, morphology, syntax, and pragmatics. Phonology is the speech of sounds. Semantics is our vocabulary. Morphology is endings on words that express grammatical relationship like past tense and in English. Syntax is the grammar. Pragmatics is this is social communication, inferencing figurative language. I have here a video to further understand these 5 domains.
Language is composed of 5 domains: phonology, semantics, morphology, syntax, and pragmatics. Phonology is the ability to make out phonemes when listening and using them appropriately when talking. A phoneme is a unit of sound. When written, phonemes look something like this. The M with the slashes is a way to write the sound M. The I with the slashes is a way to write the sound E. The K with the slashes is a way to write the sound K. The English language has at least 44 phonemes. For the purposes of this video, we won't dive too much into phonology, but know that this is an important component of speech. Semantics is simple. This is our vocabulary. This is our knowledge of what words mean and how to put them together when writing and talking. Morphology. Think of morphology as the way to make new words with existing root words. Morphology is the grammatical components of language. For example, I can change the prefix or the suffix of a word to change the meaning. Think of the word happy. I can add un in front of happy to be unhappy, or I could add est to the end of happy to be happiest. Syntax is how we put words together. This is our knowledge of the sentence structure of language. We can make simple sentences, or we can build into more complex sentence structures. I'm going to provide some sentence examples. Think about how each sentence I make becomes more complex. The dog plays. The dog plays with his toys. The dog plays with his toys in the backyard. The dog plays with his little toys in the backyard. Last, we have pragmatics. Pragmatics is the social component of language. This is our ability to know when to use eye contact, how close we should stand next to somebody, when to take conversational turns, or how to stay on topic during conversation. Pragmatics is often a major deficit area in individuals with autism spectrum disorder. So to review, speech is the production of sounds, and language is the comprehension of a spoken, written, or other symbol-based system.
I hope that you understand the 5 domains. Now let's proceed to the signs of speech and language disorder. Children's signs of a language disorder. Birth and older, does not smile or interact with others. 4 to 7 months, does not babble. 7 to 12 months, makes only few sounds or gestures like pointing. 7 months to 2 years old, says or does not understand what others say. Then 12 to 18 months, say only few words. Then 18 months to 2 years, words are not easily understood. Then 1.5 to 3 years, does not put words together to make sentences. 2 to 3 years, has trouble playing and talking with other children. Then 2.5 to 3 years, has trouble with early reading and writing skills. 8 months to 1 year, likes to hear you talk and read, looks at pictures in books when you read. Then 1 to 2 years, makes sounds or words when looking at pictures in books, points or touches pictures in books when you name them, then turn pages in books. Then 2 to 3 years, knows that books have a front and back, enjoys books that have rhymes, points to and names many pictures in books. So it is important that you as a parent, you need to be talking to your child or interact with our kids as much as possible. For 4 years old, uses only 3 words or phrases. Speech is not understandable to parents. Third, takes a long time to understand others. Fourth is difficulty asking questions and finding words to express thoughts. Then for 5 years, speaks only simple sentences. Then second is speech is not understandable to teachers. Third is difficulty answering questions, difficulty with complex directions, difficulty telling stories, and difficulty with peer interactions. Then for school age, difficulty with reading, writing, or math, difficulty following directions or repeating sentences, uses sentences with grammar errors, limited vocabulary, and also difficulty with social interactions. For mothers who are pregnant or unborn babies, parents, you can check your pediatricians about any possible disorders that your child may have. And if your child shows these red flags, or you are concerned about other aspects of your child's speech and language development, contact a speech-language pathologist. I will discuss about speech-language pathologist later. It is also very important for parents like me to know what can we do to enhance our child's development. So first in the list is listen and respond to your child. So ug naa gani pangutan na ang imong anak or ang usa ka bata is tubaga lang sad kay ang mga bata man gud is kanang kuan kay ni sila kanang curious kay ba, so dahil kay ni sila mga questions. So as ikaw nga gipangutana sa bata, dapat sad ka mo respond og usa kay gipangutana og di sa masuko dayon kay daghan siya nag mga pangutana ang bata. Then by answering those questions, maka-help yun to sa pag-develop sa bata kay ang bata is mas maayo man gudin sila memorya, dali ra sila ka-memorize. Unsa ug unsa pod gani ang imong itubag dapat is kanang sakto gyud ayaw nang kanang binuang or unsa dela. Second is talk, read, and play with your child. So mao na siya, give time pud sa imong anak nga makigduwa-duwa sad ka ayaw sad dili sad nimo siya kanang pasagdan lang. Then imo siyang tabi-tabian, then tudloan nimo siya basa. Then third is talk with your child in the language you are most comfortable using. So ikaw as nagtudlo ka, ay sa tudlo og Chinese ug di sa kakahibaw og Chinese. Like kung kibaw kag English, basic English, imo siyang tudlo hinay-hinay. Ana. Then the ways sad ka mo communicate sa imong anak is kanang pwede ra man ka magamit og like kani Bisaya kaysa magtudlo-tudlo ka og English mo. Istorya ka niyang English, mag-communicate ka with in English, then wrong grammar di ay. So sayo lagi hapon ang ma-remember sa bata. Then fourth is no, it is good to teach your child to speak a second language. So this is the time, especially for toddlers, you can communicate them using English, like basic English lang sa. Then fifth is talk about what you are doing and what your child is doing. Then sixth is use a lot of different words with your child. Then use longer sentences as your child gets older. So magkadako imong anak is imong istorya is magkataas sad ayo sad kanang pina-baby talk lang gihapon. Then kani siya importante gid din siya nga have your child play with other children. So ayo ka guol nga mahugaw imong anak or maguol ka nga iyang kaduwa is kanang hugaw baron. Kay importante sad na sila nga napura sila playmates kaysa magsigara na sila pundo sa balay. Then, playing with other children is one way pod nga ma-develop pod ang language sa usa ka bata. So let's proceed to the signs of speech sound disorder. This is for children. First is says P, M, B, H, and W incorrectly in words 1 to 2 years. Then says K, G, F, T, and D, and N incorrectly in words 2 to 3 years. Then produces speech that is unclear even to familiar people from 2 to 3 years old. So what parents can do first is say the sounds correctly when you talk. It is okay if your child makes some mistakes with sounds. Then second is do not correct speech sounds. It is more important to let your child keep talking. Next is signs of stuttering or disfluency. First is repeats first sounds of words. Example is ball. So ang B is makadaghan niya og sulti. Then second is speech breaks while trying to say a word. For example, boy for boy. So mura siya ma-break siya insulti niya sa boy. Then third is stretches sounds out. Then example is farm. Then madugay niya og kanang sulti ang F. Then fourth is shows frustration when trying to get words out. Then what parents can do first is give your child time to talk. So ayaw siya dali-dali. Second is do not interrupt, stop, or tell your child to slow down while they are speaking. Then third is see a certified speech language pathologist if you are concerned. Next is signs of voice disorder. First is loss of voice. Second uses breathy voice. Then third speaks with strain and effort. Then what parents can do first is see a doctor if your child sounds hoarse or breathy. Second is tell your child to avoid shouting and screaming. Then third is drink water throughout the day. Then fourth is include quiet time, voice rest during the day. Then now let's proceed to the adults. Signs of speech and language disorders. First is struggles to say sounds or words. Then second is repetition of words or parts of words. Third is speaks in short, fragmented phrases. Then fourth is says words in wrong order. Then fifth is struggles with using words and understanding others. then difficulty imitating speech sounds, then inconsistent errors, then slow rate of speech, slurred pitch, then lastly, slow or rapid rate of speech, often with a mumbling quality. Let us now proceed to the causes of speech and language impairment. Common causes of these impairments include: first is hearing. You must know how important hearing is to development of language of speech. So first, the thing you can do is make sure your child hearing adequately. You can approach the school district. They will be able to help you find an assessment center to test your child's hearing. Also, university who typically have programs like audiology or speech language pathology, they will have students that actually looking for practicum hours to test kids. So one causes can be hearing. Another causes is physical impairment such as cleft lip and cleft palate and vocal abuse or misuse. Children born with cleft palate may have delay in the beginning of speech and development of speech sounds. In addition, children with cleft palate may produce speech errors. A child with a cleft palate or cleft lip may need to work with a speech language pathologist. Speech language pathologist works in health care and diagnoses and treats a wide range of speech, language, cognitive, and swallowing disorders. They work with patients affected by a variety of neurological events such as brain damage, stroke, seizure, or cancer. Vocal abuse or misuse include shouting, screaming, or yelling, smoking, coughing, excessive talking, and many more that harm the vocal cords. Another issues can be genetic issues such as Down syndrome or autism spectrum syndrome. Those can cause speech and language delays that are just inherent with disorder itself. Another causes is brain injury and drug abuse. So how does brain damage affect speech? The speech produced by a person who has traumatic brain injury may be slow, slurred, and difficult or impossible to understand if the areas of the brain that control the muscles of the speech mechanisms are damaged. How can brain damage affect a child's development? Children who suffer a severe brain injury may lose some function in muscles, speech, vision, hearing, or taste. This depends on the area of where the brain is damaged. Long or short-term changes in personality or behavior may also occur. These children need lifelong medical and rehabilitative treatment. Drug use during pregnancy is a well-known risk factor for manifestation of speech-language disabilities. Drug abuse, sometimes also called substance abuse. Drug abuse affects all of the body because when drugs are ingested or otherwise consumed, they enter the bloodstream and are carried all over. Harmful substances enter the brain, and when this substance affect the communication control center, the impairment in speech and language can occur. We have here the treatments of speech and language, or the possible treatments for speech and language impairment. First is speech therapy, second is alternative communication methods, third is physical therapy, fourth is sensory integration therapy. Now let's proceed to the speech and language pathologies, or the SLPs. What does a speech pathologist mean? What does a speech pathologist do? And what is the difference between speech therapist and speech pathologist? Speech language pathologist defined as a specialist who evaluates and treats patients with speech language cognitive communication and swallowing disorders in individuals of all ages, from infants to elderly. They assess, diagnose, treat, and help to prevent communication and swallowing disorders in children and adults. The difference between speech pathologists and speech therapists is that the term speech pathologist is used by professionals to describe themselves. Lay people have more often referred to us as speech therapist, a person who does not have specialized or professional knowledge of a subject. Next is assistive devices, or the assistive technology that can help both students and teachers. These devices helps a person with hearing loss or voice, speech, or language disorder to communicate. These terms often refer to devices that help a person to hear and understand what is being said more clearly or to express thoughts more easily. First is hearing loop or induction loop systems use electromagnetic energy to transmit sound. Another device is FM systems use radio signals to transmit amplified sounds. They are often used in classrooms where the instructor wears a small microphone connected to a transmitter and the student wears the receiver, which is tuned to specific frequency or channel. Next is alerting devices such as doorbell, telephone, or alarm. Another device is infrared systems. Use infrared light to transmit sound. A transmitter converts sounds into a light signal and beams it to a receiver that is worn by a listener. Let's proceed to the 7 strategies in teaching. First strategy is respond to what students say rather than how they say it. Second is make typical eye contact with students and pause a few seconds before responding to show them how to relax and slow down the pace of conversation. Third, stay calm. Do not hurry students when they speak. Criticize, correct their speech, or force them to speak in front of others. Fourth strategy is establish a learning environment that encourages all students to take their time in responding and answering questions. Fifth strategy is teach all students to monitor and think positively about their speech and how to respond to other people who have language difficulties. 6. Have students read in unison with their classmates if they tend to stutter when reading aloud. And lastly is be a good speech model by using a slow and relaxed speech rate, pausing at appropriate times when speaking, and using simplified language and grammatical structures. For the last part, I have here the activities, or what are the classroom setting activities that the teacher gave to his or her students. For students with speech and language impairment, especially for toddlers, they are more on visual and sounds. So they like pictures, colored pictures. An example of these are flashcards. For preschoolers, same flashcards with pictures, colored pictures. Then let the child read what the picture is again and again to enhance his or her speech and language. These next classroom activities is applicable both children and adults. Considering that these students are special, their types of classes is more on games or any type of activities that can catch their attention or to participate them in any way so that their speech and language will develop. Word games activity expand a children's vocabulary. It can be as simple as pointing out items inside the classroom. This is considered as activity which is telling jokes, considering you are teaching special education. You can read joke books and take turns telling witty stories. Next is riddles. Riddles are fun ways to use words and paint pictures of scenes or situations. Read or say riddles aloud to your children, then explain it. What are the different definitions of a single word? Example, school as in a place of learning, or school as in a group of fish, to help them understand the riddle better. Next is rhymes. The repetitive chanting, reading or writing or hearing rhymes promotes good listening skills and memory retention. Aside from developing speech, you can also narrate what you do at home with rhymes, words, or let your children tell you about their favorite toys using rhyming words. Next is storytelling. While storybooks provide ample entertainment, sharing stories, whether real or make-believe, this will help develop their communication skills. You can also exchange stories about daily events, broaden their imagination with fantastical stories, and let their creativity grow as you make up stories about anything and everything around them. Next is songs. Songs are also good activities. Aside from harnessing their musical abilities, songs also help children learn new words. Lyrics have a sense of rhyme and rhythm, so it will be easy and entertaining for them to sing along. In addition, simply putting a tune to an activity can be a fun game that you can play with your students. Then we also have tongue twisters. These are an excellent and fun way to teach children correct pronunciation and enunciation of words. It is a fun way to train their tongue to pronounce words. Start with simple ones and work your way up. These are the fun activities that you can share with your students. We also have speaking activities for adults. One is short talks. Create a stock of topic cards for your students so that each student will have their own card. Each student draws their card and then you assign them a time limit. This limit may be 1 minute initially or maybe 3 minutes when they have had practice. This is the amount of time that they have to speak about their given topic. Teachers can also let them write down 3 or 5 sentences on the flashcard to remind them of the direction they'll take in the course of their talk. Number 2, show and tell. Students can be asked to bring to school an object to show and tell about. This is lots of fun because students will often bring in something that's meaningful to them or which gives them pride. That means they'll have plenty to talk about. Encourage students to ask questions about each other's object. Teacher may also provide the objects instead of having students bring their own objects. Generate a stronger discussion and keep things flowing by asking students open-ended questions. Number 3 is bingo. Dili bingo nga ka nang involve of kwarta ha. Then, many people think of this game as a listening activity, but it can very quickly become a speaking activity. The teacher can create a set of bingo cards containing example 25 words, phrases, or even whole sentences. Each card can contain the same set of words arranged differently, or you can choose to have more or less 25 items involved. Then rather than having students mark up their cards, you can give them markers such as stones or sunflower seeds to place on each square as they recognize it. Third is to text. This challenging task is great for more capable students and it involves reading. Having text in front of them can make adult students feel more supported. Choose 2 short texts and print them out. Print enough of each text for half of the class. Create a list of simple questions for each text and print out the same quantity. And then divide the class into 2 groups and hand out the text. One group gets one text, the second group gets the other text. The text can be about related topics or not. Then group members then read their text and are free to talk about them within their group. Last is running dictation. This useful activity requires students to use all four language skills: reading, writing, listening, and speaking, and it carefully planned and well controlled can cause both great excitement and exceptional learning. Example is pair students up, choose who will run and who will write. So this type of activity is the child can participate and show his or her skills by reading, writing, or listening and speaking to his or her classmates. This can improve his speech or her speech and language impairment. As a teacher and teaching these types of students, you should be more patient because it will take much time to teach these beautiful students. To end this report, I'll just give some reminder that it is very important to identify speech language problems early so your child can begin treatment as soon as possible. And if you're concerned about how your child is communicating, start with your pediatrician. Your doctor may suggest you take your child to a speech language pathologist or SLP for a comprehensive evaluation. So that is for today. Thank you for listening.